Here at Skyway Defense, we've partnered with North American Rescue to provide an individual first aid kit. We're going to go through the components that are in this actual kit. First, you have a North American Rescue CAT tourniquet. Then you have a pressure dressing for non-life-threatening hemorrhage or areas that you can actually get a pressure dressing on. You have your trauma shears to be able to remove clothing and visualize where injuries actually are. You have a survival blanket to make sure we maintain thermoregulation of any patient that has undergone severe bleeding. We have 2 packs of wound packing gauze, which would be utilized for compressible areas of hemorrhaging that we can't get a tourniquet or a pressure dressing in place. You have 2 sets of gloves for personal protective equipment. And then you have a small Sharpie to be able to write the time that you replaced the tourniquet on the patient. If you look on this Z gauze, there's actually a blue line in here. The purpose of that is so you can actually see it on radiograph so we don't accidentally leave any material in our patient that we're working on. This Sharpie doesn't seem very important, but it is very important. We want to make sure we are documenting a time. If you look on the CAT tourniquet, there's actually a tab that crosses over your windlass when you have this secured on somebody that marks the time. We really have the hard and fast data is about a 4-hour window to try to get this tourniquet off somebody before they risk losing that limb. So it's really important that we know what time we put it on. That's why this little Sharpie is in here. If you notice, there's a survival blanket in your IFAK. That's because any patient that has undergone a bunch of bleeding or lost a lot of blood is at risk for getting really cold, which is what we call hypothermia. So even if the temperatures here in Florida are over 90 degrees, we still want to make sure that we wrap our patients in thermo control, which is why this is in your kit.